Hello, fellow COVID hostages. This is Dr. David Gabriel, naturopathic doctor and registered acupuncturist. I just wanted to drop a short video today on something that I've been observing quite a bit in the clinics that I frequent, and that's people's mindset. And specifically, we all know that if you have like a serious health problem, you go to the doctor, you go to the hospital. It's obvious, it's simple. But that's not what I want to talk to you about today. Today I want to talk about the other problems. So the problems that are not as serious, that you kind of live with, that are don't you're still functional when you have them. They could be things like poor digestion, headaches, an ache somewhere, canker sores, which I'm going to talk about in a minute. Problem with your eyes, or something small it's annoying, it bothers you, it definitely decreases your quality of life, but you're still fully functional. And these are the things that people tend to ignore. Especially, not always, but especially it's ignored when you go to a doctor and the doctor doesn't help you, doesn't do anything useful. You go, they talk, sounds good, but when you get home, you're like, well, what just happened? Nothing. Nothing happened. And the thing is, these little problems that maybe are annoying or inconvenient, but you're still fully functional, these problems can be a sign or a symptom of something that's much larger. Something that maybe hasn't fully materialized yet, but will further down. And you're going to have to deal with it sooner or later. And I want to tell you a story about that. So when I was born premature, and I had significant digestive issues, let's say. I was very colicky. Apparently, I was total hell for my parents. Probably still am. And my memory of this doesn't start till maybe when I was 6 or 7, and there was always a problem around eating. I always felt sick after eating. There was a lot of vomiting. And then fast forward to maybe preteen years, get into puberty. I started getting canker sores. Now, I think most people know what canker sores are. They're damage to the lining on the inside of your mouth. So they present as these small, white, circular lesions on the inside of your cheek, on your tongue, gums, or the back of your throat. And they're annoying, and they sting, and they go away in a few days. But because of whatever issue I was dealing with, it wasn't really like that for me. My cankers would come not just a few times a year, it would come more like a few times a month. And they would get to the size of a dime, which if you get cankers, that's pretty big. But they could also get to the size of a quarter, and if I was really lucky, they would get actually to the size of a loony, which at that point it's not even a canker sore anymore. It's more like just a mouth ulcer. So they're quite painful and made eating very difficult. And then on top of that, not every meal, but many meals would end in me feeling just awful, terrible, completely drained, ready to sleep, very bloated, and just awful. So, my parents did what parents should do. They took me to the doctor, right? My doctor was very knowledgeable. He had been a doctor for a very long time. He was my doctor from before I was born. And, he was a really, really, really good man, but he didn't really help me much. And that's the thing. He never talked about my digestion. He never talked about ways I can improve my digestion. When my parents took me and showed him my canker, at that time it was the inside of my cheek. I'll never forget this day. He's like, okay, hold on a second. He opens up the cupboard behind him. He takes out this big glass jar that was filled with these things that look like oversized matchsticks. He takes out one of the matchsticks. He tells me to open my mouth. He sticks the end of the matchstick. The end of the matchstick was blue. He sticks it in my mouth against the inside of my cheek, against the canker. At first I didn't feel nothing but the pressure, but after a few seconds, blinding pain. Just blinding pain. Sharp stabbing pain, as if someone took something dull and stuck it on the inside of my cheek and poked it right through. On top of that, burning very severely. I'll never forget that. And after that, me just kind of like tears in my eyes, holding the side of my cheek. He's like, well, if you ever get a canker again, just come back and we'll do that. No problem. And that was his solution. Now, I didn't find out till years later that matchstick was actually, the end of the matchstick was actually silver nitrate. And what he did was literally cauterize the canker. Apparently, they still do this. It's overall a terrible treatment. It caused more pain than the canker did. The life of the canker actually was a little shorter, maybe about 25% shorter. But overall, it was just a terrible treatment. They still do this, the silver nitrate for cankers. I don't want this to be about cankers today, but if you have cankers, come see me, because that's just not acceptable. But anyways, obviously after that, I was like, I'm not going to the doctor anymore. Obviously, the doctor can't help me with this situation because it didn't fix the problem. I still got cankers after that. He just cauterized the ones I was getting. But why was I getting them? Why was I getting the cankers? Why did I feel so horrible around eating? Anyways, there are people that I talk to these days that have these types of issues, that they went to their doctor, they talked to their doctor, nothing quite materialized, no solution really came out of it, and they feel like, okay, this is not a very serious problem. This is just something that I have to deal with. It's just one of those things. It's just my body, whatever it is. I know that people feel that way. I know exactly how you feel because I felt that way. You just feel like you're outside the scope of the medical system, right? But the thing is, the difference between now and when I was, say, a teenager, is that now this type of medicine, we could call it functional medicine or we can call it complementary medicine, whatever you want to call it. It's a parallel system to the conventional system. Wasn't widely available at that time. Now it is. You don't have to suffer. It's just needless, right? You can talk to someone like me. You can talk to a naturopathic doctor. And in most cases, I can help you. But I've worked at a lot of clinics. I know a lot of practitioners. So worst case scenario, if I can't help you, if it's outside the scope of my abilities, I can easily point you to the right direction, to the right people. So I just wanted to let you know that I know how you feel about those little issues. And keep in mind that just because a medical doctor wasn't able to solve the issue doesn't mean it can't be solved. And also, if you have these little issues, it can be a sign of something that's a little bit more fundamental to your health, a little bit something that it could be a sign of something that's to come, a problem that's kind of building. And you don't want to leave those things. And listen, if it's dampening your quality of life, why? Like, why let it, right? You have the possibility of a solution right in front of you. Okay, that's all I really want to say for today. I know how you feel. I've been there. Okay, so thank you very much for listening to the end, and we'll see you next time. Thank you very much.